Do you know if you need to take a coronavirus test? Do you know if you're at risk? There's a website. Benjamin Newsma created it, and you can learn about it in the Economic War Room to take a simple quiz, and you'll determine whether your family's at risk and what you should do about it. Benjamin, it's a pleasure to have you here. I know we have a mutual friend in Rod Martin. He's a friend of the Economic War Room, and he talks about the amazing things that you're doing to protect our nation, to protect NGOs, non-government organizations around the world, and you're using technology to do it. So it's a pleasure to have you here.
It's a pleasure to be here.
Yeah, so let's talk about this new threat, COVID-19, the Chinese coronavirus. Tell me some of the ways that technology can help protect the American people.
Yeah, absolutely. So at this point, technology can help people understand this better. So one of the biggest issues that the American people have in general with this is comprehending it. What does it mean? Specifically, what does it mean for you? And then how does it change how your behavior needs to respond in medical related situations?
Okay, so technology information is one of the critical things we need to fight the battle. So people are working from home more now, right? So technology has enabled that. That wasn't possible 20, 25 years ago, correct?
Oh, absolutely. And beyond that, telemedicine is really taking off. So there's been a need, since the technology has existed for a while, for hospitals not to instantly dispatch an ambulance, and there wasn't an excuse, or I would say valid business reason, for them to change their behavior. And this is providing an opportunity where hospitals for the first time are being much better at triaging the entry of patients through the ambulance process by telemedicine first. So this is the end result of this is going to be higher efficiency.
Well, let's talk about that, because triage is the important thing. I've got a good friend who works at one of the major hospitals in America, and he tells me that they have critical shortages or potential for shortages of critical supplies. And so we only need the truly sick and those that truly have COVID-19 to get some of the medical responses. But how do you know if you've got it? We've had a shortage of tests, and the president talked about we've got to pick which people should be taking the test, because not everybody should take the test. And you've developed a tool that really can help with that. Let's walk through your tool. Tell me what caused you to create it, what you went about to get it, and then let's walk through it together.
So there were two things that caused us to create the tool. So one of them, we had a customer request, and we like to be very responsive. But also, I have an immune-compromised daughter. And so the biggest threat to her, oddly enough, is not coronavirus, but an overrun health system where she gets some other infection and then she can't get the treatment that she needs. So this actually has somewhat of a personal connection to me as well.
Yeah, no, and some of the best inventions in America have come because of a personal need, and it helps all of society. So let's talk about that. If we're going to find out whether or not you need to take a test, because I mean, you wake up, you have sniffles, you have a cold, maybe a slight fever, you say instantly, I've got it, I got to go deal with it. But that's not true.
Doing.
Yes, and that creates panic, and it could overrun the health system. That's what we saw in Italy, right? We've seen the health system overrun, and we want to avoid that. So where would we go to find this risk assessment tool that you've got?
So the risk assessment tool, we actually took and we released a version of this online for free for people to take, and it's basically a verbal screening test for people. Are you going to go ahead and insert the...
Yeah, tell us the website and we'll put it on the screen. Yep.
Okay. It's COVID, so COVID-19-19.navigo.cc.
Navigo is N-A-V-I-G-O. Okay, I've got it. I pulled it up on my battle pad, and I'm going to look at it. I'm going to take the assessment. So I'm on the main page, and I scroll down 2 ways we can help, and I see take the assessment, and I'm clicking on take the assessment now. And it's this free short assessment combines data from a variety of sources. It's completely anonymous. There's a disclaimer there. It says you're not medical professionals, and so this is not medical advice.
Nope,
And we don't give
exactly.
that. But let's click on Take the Assessment. Where do you live? I live in the United States. Do I just click Next off that? Because
you can also drill down into your state. So we've listed the states with significant infection levels there.
Okay, I'm going to start with United States because I know that it'll come up. It's not in an affected area, so I'll click Next on that. Are you sick? No, I'm not currently sick. How old are you? Let's scroll up to, I hate to admit it, 58 years old. Next. Am I male or female? You only give 2 choices, but I know which I am, male. Do you suffer from a major medical issue like heart disease? No, thank God, no major medical issues. All right, I do not smoke. Do I frequent higher traffic public spaces? Yes, often, not recently, but I have, 2-3 weeks ago. How often do I travel? I frequently travel, but not every week. And then wash my hands frequently. Well, do I put there, Benjamin, do I put what I do now or what I did 2 weeks ago?
I would put what you do now.
Wash hands frequently, 5 or more times a day. Okay. Have you visited high transmission areas? Help me understand that. What's a high transmission area?
So this is a place where there's known incidence of this particular infection. So if you were in a city center, and in that city center, so there's some of the cities in Washington, for example, right now, where there's quite a bit of transmission. There's more of what they would call sustained community transmission.
So not
Right.
a place, for example, I live in a location where the neighboring city has 1 or 2 cases, but that's it. Would I click
Yeah,
on?
that's not a high transmission area. You
Okay.
go to Wuhan, very high transmission area. You go to one of the major
Seattle,
cities in Italy
New
right
York,
now.
Italy, okay.
Yeah, and in Seattle, I would say even more that, kind of the localized area where the infection is spreading
Okay.
right now.
Got it. So New Rochelle maybe would qualify there. All right, I haven't visited a high transmission area. My results. Based on your responses, likelihood of contracting the coronavirus is small chance. And chance you do contract it, I'm at lower risk. Wow, that's great news. So it's a very
Congratulations.
simple 2-minute at maximum test to take. Talks about my profile. Tell me, this sounds like just what the president was promising Google might be producing, or Verily, I guess, which is an Alphabet subsidiary, might be producing, and you've got it up and running and operating now.
Yeah, that's correct. We have, it's available now, and then the version we're working on for the healthcare providers will allow a provider to send it out, and then it'll still be, the information will be captured anonymously except for to them.
Now
right?
let's talk
help
about
them
how
pretty
this
much.
could be used in telemedicine. So I get my doctor on the phone, and Dr. Smith tells me, she says, well, what is your likelihood? I've got a slight cough or whatever, and she says, what's your likelihood? She could have me take this assessment and then maybe do some other monitoring and diagnose over the phone or over Skype like we're talking now. And
Do you want to retake it really quick as a sick person?
yeah, let's do that. Let's retake the assessment. Let's take the assessment. What should I put? United States? I'll leave that there.
Yeah, United States is good. Just say that you're sick.
Yes, sick. Do you have a high temperature or fever? What do you want me to say? Tell me.
I would say yes. Yeah,
Yes.
let's say that you have a high temperature,
And how
You
about
have
the
it.
cough?
new continuous cough.
Yes? All right.
Yes.
Tired or fatigued? Yes. Coughing
then-
up sputum, thick phlegm, or mucus from my lungs?
I
Yes. Let's
go
do the
ahead,
worst
say
case.
yes.
Do you have shortness of breath? None of these are true. Can I leave my
Yeah.
same age, or should I let me take me up to 80 years of age?
Yeah, go ahead and take you up to 80.
Male or female? Let's just stick with male.
Yeah, males are actually at higher risk.
Okay, higher risk, and then multiple medical issues or one major. Let's do the worst. Multiple medical issues, and I smoke. I've smoked
Yeah,
at
you're a
least once a
chimney.
week. Yep. Frequent higher transmission. Often travel every week. Do I wash my hands frequently? Not very often. Briefly at a high transmission area or spent significant time. Oh, testing. Because you're a high risk and your symptoms are possible, we recommend you contact your healthcare provider about whether you should get tested. So that would be an example of someone who is at risk and has not taken the proper precautions, and so the assessment just says absolutely.
Yeah, yeah. And the primary goal of this is to help triage so that the right people get tested. So because even amongst the right people getting tested, the percentage of people who actually have it at this point are going to be very small.
Yep.
But the problem is that if you've got Walgreens set up as your testing point, and then old Mrs. Nellis, 80 years old, is 4 blocks back and desperately needs to be tested, and then you've got a bunch of people my age or your age in line in front of her who are low risk.
Right.
If they're feeling sick, they should just stay home. There's no reason for them to use up the viral media for the testing. There's no reason for them to really even be in line at that point. Unless their case is bad enough that it warrants hospitalization regardless, at which point they need to call up their healthcare provider. They need to say, look, these are my symptoms. Here's how sick I am. At which point they'll probably be told, you likely don't have it, but we need you in the hospital because we don't want you dying anyways, right? But that's the thing, is if we can really triage this, we can afford scarcity.
Well, you've done a great service here, Benjamin. Tremendous effort. We're going to encourage people to go visit this and familiarize themselves with it, because information is one of our best weapons to fight this. And I also want to congratulate you as an entrepreneur, as an American free enterprise loving entrepreneur, because I really truly believe that with technology, with sound minds and good attitudes and hearts, that the entrepreneur in America and that spirit that we have is going to conquer this like we've conquered so many other problems throughout our history. So congratulations to you, Benjamin. Tremendous work at Navigo, and really thank you for all that you're doing.
Well, thank you so much. Really enjoyed our conversation.
We need entrepreneurs, inventors like Benjamin Newsma. With technology, with liberty, personal freedoms, and with private enterprise, America can win this war against COVID-19. This is Kevin Freeman from the Economic War Room.